Section 45 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 7c. The thoracic portion of the sympathetic system. Pars thoracalis est sympathesi. The thoracic portion of the sympathetic trunk consists of a series of ganglia, which usually correspond in number to that of the vertebrae, but, on account of the occasional coalescence of two ganglia, their number is uncertain. The thoracic ganglia rest against the heads of the ribs, and are covered by the costal pleura. The last two, however, are more anterior than the rest, and are placed on the sides of the bodies of the 11th and 12th thoracic vertebrae. The ganglia are small in size and of a grayish color. The first, larger than the others, is of an elongated form, and frequently blended with the inferior cervical ganglion. They are connected together by the intervening portions of the trunk. Two rami communicantes, a white and a gray, connect each ganglia with its corresponding spinal nerve. The branches from the upper 5 ganglia are very small. They supply filaments to the thoracic artery and its branches. Twigs from the 2nd, 3rd, and 4th ganglia enter the posterior pulmonary plexus. The branches from the lower 7 ganglia are large and white in color. They distribute filaments to the aorta and unite to form the greater, the lesser, and the lowest splanchnic nerves. The greater splanchnic nerve, N. splanchnicus major, great splanchnic nerve, is white in color, firm in texture, and of a considerable size. It is formed by branches from the 5th to the 9th or 10th thoracic ganglia, but the fibers in the higher roots may be traced upward in the sympathetic trunk as far as the 1st or 2nd thoracic ganglion. It descends obliquely on the bodies of the vertebrae, perforates the crust of the diaphragm, and ends in the celiac ganglion. A ganglion, ganglion splanchnicum, exists on this nerve opposite the 11th or 12th thoracic vertebra. The lesser splanchnic nerve, N. splanchnicus minor, is formed by filaments from the 9th and 10th, and sometimes the 11th thoracic ganglia, and from the cord between them. It pierces the diaphragm with the preceding nerve and joins the aorticorenal ganglion. The lower splanchnic nerve, splanchnicus immus, least splanchnic nerve, arises from the last thoracic ganglion, and, piercing the diaphragm, ends in the renal plexus. A striking analogy exists between the splanchnic and the cardiac nerves. The cardiac nerves are 3 in number. They arise from all 3 cervical ganglia, and are distributed to a large and important organ in the thoracic cavity. The splanchnic nerves, also 3 in number, are connected probably with all the thoracic ganglia, and are distributed to important organs in the abdominal cavity. 7d. The abdominal portion of the sympathetic system. Pars abdominalis est sympathesi, lumbar portion of ganglionated cord. The abdominal portion of the sympathetic trunk is situated in front of the vertebral column, along the medial margin of the psoas major. It consists usually of 4 lumbar ganglia, connected together by interganglionic cords. It is continuous above with the thoracic portion beneath the medial lumbocostal arch, and below with the pelvic portion behind the common iliac artery. The ganglia are of small size and placed much nearer the median line than are the thoracic ganglia. Gray rami communicantes pass from all the ganglia to the lumbar spinal nerves. The 1st and 2nd, and sometimes the 3rd, lumbar nerves send white rami communicantes to the corresponding ganglia. The rami communicantes are of considerable length, and accompany the lumbar arteries around the sides of the bodies of the vertebrae, passing beneath the fibrous arches from which some of the fibers of the psoas major arise. Of the branches of distribution, some pass in front of the aorta and join the aortic plexus. Others descend in front of the common iliac arteries and assist in forming the hypogastric plexus. 7e. The pelvic portion of the sympathetic system. Pars pelvina es sympathesi. The pelvic portion of each sympathetic trunk is situated in front of the sacrum, medial to the anterior sacral foramina. It consists of 4 or 5 small sacral ganglia, connected together by interganglionic cords, and continuous above with the abdominal portion. Below, the 2 pelvic sympathetic trunks converge, and end on the front of the coccyx, in a small ganglion, the ganglion impar. Gray rami communicantes pass from the ganglia to the sacral and the coccygeal nerves. No white rami communicantes are given to this part of the ganglionated cord, but the visceral branches which arise from the 3rd and 4th, and sometimes from the 2nd, sacral, and run directly to the pelvic plexuses, are regarded as the white rami communicantes. The branches of distribution communicate on the front of the sacrum with the corresponding branches from the opposite side. Some, from the first 2 ganglia, pass to join the pelvic plexus, and others form a plexus which accompanies the middle sacral artery and sends filaments to the glomus coccygeum. Coccygeal body. End of section 45. Recording by David Lawrence, October 2009, in Brampton, Ontario.